Mpox, was normally known as monkeypox, has been endemic in many countries, and it has been reported of late in Europe, Africa, United States of America, and many other countries in the world. But all of a sudden, since January this year, a total of 15 countries in the Africa region have reported Mpox outbreak. And within those 7 months, a total of 14,250 confirmed cases have been reported, with 456 deaths have been reported. And in the Democratic Republic of the Congo, 90% of the reported cases are actually originated from there. Mm-hmm. Now, given the sudden increase in the number of cases and the concomitant deaths, the World Health Organization has declared Mpox as a public health emergency of international concern, and also the African CDC has declared the Mpox as a public health emergency of continental security.
Now, Doctor, could you also provide an overview of the current Mpox situation in Namibia, including whether any cases have been reported so far, since there have been some false rumors going around on social media?
Yeah, Namibia has a robust surveillance system which picks up any disease which may occur in the country. You may remember that some years ago we had one case of Crimea Congo hemorrhagic fever which was reported, and it was immediately detected and contained, so that no any other cases resulted from that. In the case of Mpox, we have the same surveillance system which can pick up Mpox, and so far Namibia has not detected any case of Mpox. I am aware of some social media posts which purports that a number of cases in different towns of Namibia have been reported, and I want categorically to state that this is a pure fabrication, and as at the present moment we do not have any case of Mpox in Namibia.
Now, Doctor, can you explain the transmission methods of Mpox and how the public can protect themselves from infection for future reference?
Yes. Mpox is a zoonotic disease, which is it's a disease which can be transmitted from animal to human. Mm-hmm. And that can occur in a direct contact with the blood, of bodily fluids, of a continuous or mucosal lesion of an infected animal. Now, the human-to-human transmission can result from a close contact with the respiratory secretions, body fluids, skin lesion of infected person, or from the contaminated objects. Now, the person who contracted Mpox the incubation period, let's say, is about from 5 to 21 days. But the symptoms for a person to be able to pick up that he might be having Mpox, the symptoms include high fever, it includes headache, very intense headache. There will be lymph nodes enlarged, pains in the muscles, and importantly, there will be rash on the body, which those rashes, with time, they turn into blisters, and crusts. So these rashes, normally they tend to concentrate on the face, on the palms of the hand, and on the sole of the feet. So these are mostly the symptoms of Mpox. But a person can prevent themselves from contracting Mpox by, if a person is diagnosed with Mpox, that person needs to be isolated. And secondly, I do just want to remind ourselves of the practice which we have been preaching during COVID-19. That is to practice good hand hygiene and personal hygiene. That is very much important. And also, if a person knows that there are materials which have been in contact with a person who is suspected or confirmed to have Mpox, this must be avoided. So the Mpox virus can be destroyed with the washing machine or with warm water or whatever. Or the use of personal protective equipment is also a bearing method to avoid contact between an infected person and also a healthy person. So basically, if we practice the good method we used during COVID-19, I just want to urge the Namibians to remain calm and not to follow social media posts and information, any information which is not coming from reliable sources. As we have done in always, if there is anything happening in Namibia related to Mpox, we'll promptly inform the public and also inform the public what needs to be done. If any information does not come from the Ministry of Health and Social Services, please be advised to ignore such information.